cardboard splint that's going to be put together like this. Okay? Anything elbow and below. Anything humerus and above, you can just use a sling and swat. I'm going to show you both methods. So if you get elbow or below, you're going to put the cardboard on her, and you're going to also secure it with the sling and swat to the body. Okay? So this is to secure the injury, and the sling and swat is really just to secure the injured site to the body so it doesn't chicken wing or move anywhere. Okay? So a little game. Fracture. Cardboard, no cardboard. Cardboard. Please. No cardboard. Yay! Cardboard. Yay! Okay, you all know what I'm talking about. It's Tommy's game, I'm showing. Play a little game. Okay, so I think at state they're just going to say you have a so-and-so injury.
Right.
And then it's up to you to figure out what you're going to be using. So the bad thing is obviously to not use the cardboard when you should have used the cardboard. Right? It's not so bad to use the cardboard when you really could have just done a thing walking up and down on that. Okay. So for any station, what's the first thing we do? Yeah.
So I know it sounds silly that you keep asking, but I gotta tell you, this weekend at state, somebody actually failed the station for not saying via side seam safe.
I think it was on my station, actually, for AED.
Oh God.
That would be the one.
Yeah.
Yeah, we had a couple people fail in their finals in my last class too because they just got off verklempt and forgot to BSI walking into scenes. So like, yeah.
Okay, so BSI seems safe. What's the next?
PMS.
Immobilize, right? Manually stabilize something. So let's say that right now I have an injury somewhere on her radius on that portion of her arm, right? Because you're never going to know. You're not expert technicians, so you don't say the fracture, you say the injury site. Okay, so I'm going to have a partner immobilize it. So basically how we immobilize it is that we can hold on to here, but I can also have my patient hold on here sort of to guard it a little bit, okay? So I'm going to, if she's just sitting down like this, I'm just going to ask her, I'm just going to actually say my partner is going to stabilize the arm to the body right here and stabilize the injured site, okay? And at this point I'm going to give her this can of beer, okay? And I'm going to, stop laughing at me. And I'm going to tell her to drink to make her feel better. So I'm going to have her hold it, okay, because position of function of the hand is not necessarily like this. So we're going to hold it like that. That's how we mobilize it. Okay, so you do, what's the next thing you do?
Measure.
Awesome. So you're going to check PMS, and so you're going to check it on, it's obviously the injured arm. Okay, okay. Sweet, can you wiggle your fingers for me? Awesome, and each finger. Okay, so at this point, I'm going to, and I have everything lined up too, maybe not perfectly right now, but I have it lined up. So I'm going to do the same thing, and you can actually do the same thing you did with the leg. Okay, so same thing, one piece should be enough. Don't fight it too hard. There we go. Alright, so the way I like to prepare is that I put one, since there's already padding on the bottom, I don't worry too much about the bottom. Okay? So I put one piece of padding on the side that's going to go toward her body. So since this is the right arm, I put it on the inside right here. Okay? But that's hard to get to. If I first get it on her, and then I try to pad like that, I just put it on like this. Sort of a little up like that. Okay? And then, slide it in under here, and I'm going to gently help her and my partner place the arm into the cardboard box. Okay? And so if the patient is able to, she can still hold it up here, otherwise she'll verbalize that your partner's doing it. And so, what kind of padding? I like to pad on the outside a little bit too. So people have different sizes of arms, right? So just, again, don't force it. just try to pat as much as you can, and especially around the wrist, because if you have an injury right here, what do you want to immobilize? I'm sorry? Elbow and wrist, right? So the joints above and below. If you have a joint injury, it's the bone above and below. Okay? So make sure in this case to pat around the wrist. And again, if there's, you're just going to have to sort of work it a little bit. And if there's excess room, you can always put them on a little buggers. And again, this is 5 minutes patient, so I'm just like, you know, ridiculously long my way out of this. Okay, so I just put, oh, she can hold these for me, right? There we go. So I usually just put 2 cravats. A lot of people put 3, and I just think it's kind of a waste of time. You're going to be tying it to the body anyway. So I'm going to try to slide this in here. So there we go. And it's the same thing, okay? Same kind of knot. 1, 2. And just do me a favor and don't do this. Because what happens if the cravat snaps? Okay? So,
That's a lot of paperwork, by the way.
it's a lot of paperwork. I didn't do it.
Making sure she's awake.
Right? Yeah.
Taking responsiveness.
So whatever you do,
That's
put
one
yourself
element
in
in
a
your report
position.
when you're like, yeah,
Yeah.
she had a broken arm,
Yeah.
now she has a broken face.
I go. So put
You
yourself
still
in a
Emily knows
position
she's
where
responsive to painful
you're
stigma.
not tying the knot in her face or in your face. It's kind of embarrassing to do that too, right? So, okay, so just do whatever you can. And see, it's already going like, because these cravats are kind of folded and we use them a lot. So, whatever you can do to sort of get it out of the way. One more. Oh, put it on you. Oh, that was my whole point. Yeah, don't put 3. So I just put one on there, and then I put one over the hand. And so I would be doing this with this really close to the body right now. Can I just have you take it out just so I can show you how I'm gonna tie it. So you can do one that's super tight like this. I like to make it a little wider, and then I like to put it over the hand itself. Okay? Because you're gonna want to leave room to check PMS at some point when you're done. And I just like to make it wider so it doesn't hurt your patient. Just cinch it down a little. So I'll try to put this over the hand like this. And so what I usually do is I just try to sort of cinch it down like that, and while still checking that I can still have room for movement in there. Okay. 1, 2. On the side. Tying it away from anybody I don't want to hurt. Got it. Okay, and so I can check now in here. I can still reach in here and find it. Okay, so she still has her arm up here. So this is when you want to do your sling swaths. And so the way you make your sling is you have this triangular cravat, and you can tie this little knot at the end. I'm going to try to be nice. Here we go. So you tie a little knot at the end, right? Make it so it's a little, what do you call it? So we're going to put this around her. So I'm going to come right in front of you. Don't be alarmed. There we go. And I'm going to catch sort of the inner corner right here. Like that. And I'm going to try to catch the entire cardboard box, okay? But most of all, I'm really going to, well, yeah, catch the whole thing. Right? Because when she stands up and leans forward, we don't want the arm to pop out of the sling. Okay? So I'm going to tie this around her. So this goes sort of up here around her neck a little bit, and just goes around right here. And if you can try to not tie the knot on the back, some of these cravats just won't allow for it because they're just not long enough. So we're going to try to tie it up here on the shoulder or on the side if you can. just because when you put her on the back foot, it's going to be really annoying. There we go. So, same thing.
Notice when you just did that when she's sitting here like this, her shoulders are still even. She's not all scrunched up on
yeah.
one side, right? So don't start pulling and pulling and pulling, and suddenly she's completely out of whack at that point, okay? Well, you know, please.
Yeah, no guarantee. Okay, that's the sling. So the sling basically holds it up like that. The swath is to not have it go chicken wings on us, okay? So I'm going to again put this right in front of you, and if you can lift your left arm up, here we go. So this one, if I can have you lean forward just a little bit, sweet. So this one goes right around here, okay, and it goes around her back. And again, if you can, this one is easier to tie on the side because you just go like this and tie it right here.
Make sure you're not tying your patient to the chair.
Seriously?
Yep.
Oh my gosh. Okay. So, here we go. And so I want to make sure that I caught the entire thing, right? And so right now I want to go in and I want to find all types of PMS. I hid it a little bit for myself, but yep, she has a pulse. Awesome. And within the finger speed. Awesome. And one finger message. Pointer. Okay. So I did all 5 steps, right? So CSI, skin face, manual stabilize, PMS, apply the device, PMS. Okay. And so what we're going to have you do is we're going to have you stand up and lean forward and relax her arm, right? And if it goes all floppy, then it's not very good. And then we're also going to do, that's the first thing we're going to check. I'm going to take this off. There we go. And we're going to check the wrist, right? So we're going to check how much she can actually move her wrist. And if there's excessive movement, so just try to wiggle your hand around a little bit. If there's too much movement, it's not immobilized. So those are the things that we check when you're done. Okay? And that's it.